So this patient's coming in for removal of what looks like a exophytic lesion that's been growing towards the right side of his temple. Now this has been there for a couple months, and he's gone and seen a couple of physicians, and he went to the hospital to have this removed, and they wouldn't. They sort of sent him back out. So you learn a little bit about the systems. Here in Canada, we have a good system in general, but this is the problem you sometimes get into when people aren't comfortable just because of the nature of it. They sort of defer it a little bit, and you can get into this situation where we need a diagnosis more than anything else. So if you look at the character of it, it's keratinized a fair amount, and the base is fairly inflamed. The one good thing with it is it doesn't seem to have a lot of substance underneath it. So what we're going to do here, we've already put some anesthesia in around it. We're just going to clip this, and then we're going to cauterize it and take it in layers and send this off to pathology. If this is a squamous cell cancer, which is what it looks more like, could be a variant of a basal cell cancer as well, we may have to follow up with plastic surgery. So this won't be replacing like a Mohs surgery or anything of that nature, but we'll see. I want you to see what the tissue types are like and how this responds. And the other lesson too is just not being afraid to at least send something away for biopsy. So that doesn't hurt at all? You're okay with that?
No.
All right. So all I want to do here is I want to cut this at the base. And usually you'll see with atypical cells that this becomes more friable, breaks. See how that's breaking apart in an unusual fashion. So the other thing we can tell with atypical cells is they become very, very friable. So the other thing that doesn't respond as normally is when I do the hyfrecator, which I'm going to need behind you. You can sometimes tell by the quality of it. Now if you can see, looking at this tissue type, that looks atypical. And see how that doesn't... Atypical cells don't cauterize as well either, so you'll sometimes find when you're not as sure that you're dealing with a cancerous process. And you're okay? This is comfortable? You're not hurting you at all?
No.
Good. So all I have to do here is I have to turn up the gain on it because it's not cauterizing properly. And you can always get it to cauterize. It's just a function of taking your time. You can appreciate how friable that is. That tissue is just breaking down. And when it does it, it's always atypical or oncological tissue. You're okay there? And obviously, these processes tend to be more vascular, so this is why you end up getting this happening. There's a very thick blood supply. So the other lesson when you're using a hyfrecator like this, it has to be able to conduct current. So if the area is too wet, you okay? Doesn't hurt at all?
No.
All right. So if it's bleeding too much, you won't be able to cauterize anything at all. So this is why I'm dabbing it. Take this, just make sure I scrape off as much of this as possible. So when it's bleeding like this, you want to put pressure on it, and just as you're getting to the area, then you use your hyfrecator to cauterize it. And you're seeing as I get down to more normal tissue, it's taking the cautery like it should, because we're getting past this plastic tissue. No pain there?
No.
So I use a scalpel, or you can also use a curette, and this is what I'm going to use now. But you can see how that's looking more normal, so I want to take that down, just trying to get as much of the skin off, the layers off as possible. And the other reason for this too is, so beyond, this is essentially like a very detailed biopsy. So we're going to be sending this to the pathology lab for sure. But we also, much like when you're doing the Mohs procedures, and all the Mohs procedure is they take superficial savings and send it off layer by layer to make sure it's completely clear. For basal cell cancers, you can sometimes get away with just curettaging it. So this is why when I do this, beyond just getting a good biopsy, if this turned out to be just a basal cell cancer, you sometimes that can be a definitive treatment, and you'll see that this just doesn't come back to any great degree. And you can see even now, see how that's, despite the fact that I'm irritating it, this is a normal bleeding pattern. So I'm down to much more normal tissue, and you get familiar with that as you do more of these processes. Just going to cauterize that a little bit more. And I apologize, sometimes the sound of this, you lose it when I'm hyfrecating it. And you're feeling comfortable, no problems?
For now, no.
Yeah, good. You okay? All right. So now we're just going to clean this up here, and then we'll send this off to pathology and see what we're dealing with.
Okay.